Ageria hĩndĩ ya igongona rĩa kũhumba thũmbĩ arutwo a ũrigitani thibitarĩ-inĩ mũnene wa KU. Mĩnĩsta wa ũgima wa mwĩrĩ gũkũ bũrũri-inĩ Aden Duale augĩte thirikari kũhetũkĩra ministry ĩno nĩ yarĩire mĩbango mĩkinyanĩru ya kũhũrana na kũhukia ikuũ cia ciana nini cia tũkenge hamwe na atumia arĩa makoretwo magĩkuĩra thibitarĩ-inĩ hĩndĩ ya kũheo ciana. Duale akiuga nĩ gĩconoko bũrũri wa Kenya kũrwo nĩ mĩoyo ta ĩno ihinda-inĩ ta rĩrĩ.
Any maternal or newborn death is one death too many. And this is not merely a concern, it is a call to action. And as a ministry, we are moving from statements to systems that prevent avoidable loss. We must protect profoundly the human journey of bringing new life into the world. Very soon we are going to commence a nationwide reproductive age age mortality survey to make sure that we can determine the true number and causes of death among women of reproductive age.
Oho akiuga thirikari no irathiĩ na mbere na gũkinyanĩria mũbango wa universal healthcare guothe matũũra-inĩ.
I urge every Kenyan to enroll, to seek care early and to remain in care. UHC works when people use it and when we as a system are ready to serve them well.
Arũgamĩrĩri a thibitarĩ ũyũ makiuga no megũthiĩ na mbere na kũgacĩrithia motungata kũrĩ mũingĩ.
Our chief guest KTRH continues to stand as a beacon of excellence in healthcare, research and innovation and education, guided by our mission to deliver patient-centered, evidence-based care and anchored on the values of integrity, teamwork, empathy, accountability, equity and diversity.
We remain committed to excellency in health delivery, education. Our strategic plans is headed on 5 pillars. One will be facility expansion.
Ino nĩ ceceni ya Inooro TV thibitarĩ-inĩ wa KU na niĩ njĩtagwo Moses Ngenge.